Hello there. I can see you have been having a very bad time. I see. Can you try and focus on the light? And the other eye. Okay, can you just try to follow the light? Just a quick cranial nerve exam right here. That seems okay. So, you've been into a fight, I see. What happened exactly? Okay, 3 against 1. You should have been looking worse then. So, something tells me that you actually know how to defend yourself. Or that you are quick to get away. One of those things. Okay, so let's see. I think I want to clean you up a little bit, if that's okay. I just put on my gloves. Okay, don't know that. So, I don't need to hear the full story, but let's just take some of it as we go. Yeah, I have to report this. So, I just want to clean you up a little bit. With some water here in the beginning, just some plain water. This can sting a little bit. Yeah, it's never nice to get cleaned when you have bruises and cuts. I think the worst thing is just when the blood is stiff, you know. So when it's all dry, yeah, that is not the easiest. It has like a crust. It's not nice to get that cleaned. But nonetheless, it has to be done. So it's especially at the eyebrow. They got some good hits in on you. Huh? Don't you know how to duck? Yeah, a little bit, but yeah, 3 people at once, that can be quite hard. Totally understandable. And just clean up a little bit. Can you just give me your arm? And then we'll also just clean up the things on there. Thank you. Why do I see burn marks on your arm? They put cigarettes out on your arm. I'm definitely reporting this. I'll just clean this up as good as possible. Was it the mafia or something that you were messing with? Yeah. I want to know that as well if I had to report this. I know that I'm a nurse, but it's never nice to report anything with the mafia involved. And can I see the other arm, please? Thank you. No cigarette marks on this arm. That's at least good. Okay. So, does it feel like it's most out of damage, They did not stab you or anything like that? I don't see any cuts on your clothing, and you came in here by yourself, so I guess that there's no stabbing if you say so, right? Good. Because that would be a job for a doctor. Yeah. So now for a little bit more hectic work. Yeah, this is just something to clean a little better, and it can sting very much. But if you want to fight, I don't know if you started it or you were just attacked. But if you get in fights, then we need a little bit of this as well. Just to clean it completely so there's no bacteria or something like that getting into the wounds. And here I will just take some cotton swabs. So first here at the eyebrow. That stings a lot. I know, it stings very, very, very much. And the other eyebrow, they got you very good up here in the face. They clearly didn't like your face. Just cleaning the cheeks a little bit. I don't know if it is just scratches, wounds, or whatever it is, but if it's scratches, it can be infected as well. We don't want that, even though if it's just on the outer layer of the skin that has been scratched. We do not want that now. And the other cheek. Just clean and clean and clean Yeah, that's just my job for the night. Just clean you up. I think I can go home after that. Yeah, it's been a quiet night. Quiet. And done. So I'll just take a snippet here. Just to cover the eye. Oh, at the eyebrow, you know. Done. And just of course the other one as well. Done. Okay, so how do you feel right now? Thankfully the nosebleed stops quite quickly. Yeah. Got it. Good. So for your arm, I do have this right here. It's just a big patch, and thankfully it was around this size where the burn marks are. So one of these should be sufficient. So this is something I use for burn marks because there's some kind of salve on these which just will contain it and really help with the healing. So that's why I use this, and then I will pack it in with some band-aid, afterwards. So it's just a little bit more taken care of and don't fall off as easily. So yeah, it's just this that is on the inside. A very stable cloth with some salve on it. So just give me your arm. Then I will just put this on. Thank you. And then I will just put this on your arm as well. Just so we can get those burn marks as nice as possible, and so you do not get any infections there as well. It can very turn out very bad. So I will just take this and put on your arm and just roll around, and it's gonna be quite tight. You'll get a little bit more loose, and when it gets a little bit more loose, then you will just tighten it up a little bit again. Yeah, because when you're sleeping, then you're moving a lot, and then you will loosen it up a little bit. But when you wake up, just tighten it up a little bit. The Sloth can wake up to 24 hours. When it has been 24 hours, I want you to contact us again. And maybe come back in, unless we can prescribe you something for it. But that is the doctor's job. So I'll just put this on you, and round and round and round. And I've just fixated with a little clip. Now I do have a smaller one as well of these, where it is also for this kind of self. If you have gotten any burn marks other places, so if you have gotten any burn marks other places, then just say the word, then I can apply these as well. So I can see your eyes are quite red, and I do not want you to go from here and not being able to see that much, or if there's just gonna get any infections or something like that, pink eye, something like that, don't want anything like that. So when you have got these big bruises and cuts and stuff, and I also just want to give you some sterile water here in the eyes, just some eye drops. And this is just a normal salt water solution I want to apply. So just take the cover off here, and then I will just drop it into your eyes. And I have to do it a couple of times because people tend to squint their eyes when we do something like this. And I do it myself. But so you just tilt your head backwards, and I'll just give a couple of drops right here. And just blink a lot so we can get it all the way into the eye. Thank you. And the other eye as well. So just tilt your head backwards, and just drop. Okay, so if you just blink a couple of times, and so we can get it into our eyes. So unless you have something you want to tell me about the occurrence, you don't have to. I need to make a little bit of a report, so it would make it a little bit easier if you just could tell me a little bit about what happened. So I'll just take my gloves off. Okay. And did they just come out of nowhere? Is it someone you know? Okay. Is there anything else you can tell me about the incident? Okay, not that you know of. Well, my job here is done. I've cleaned you up a little bit. We had a nice conversation. I think the burn marks is the most intensive thing here you need to keep an eye on. I want you to contact us tomorrow. If you do not see a healing process, it has to get a little bit of a scar over it, and just leave it be. You can moisturize it, it's quite fine, and you also need to clean it. So I want you to go in and get some of this cleaning solution I've used on you. If you just get something like this, work just fine. But thank you for stopping by, and thank you for trusting me. If you contact us tomorrow, that would be amazing. And if I were you, I would just go home, get a good night's rest, and yeah, just forget about it. Bye bye.